Welcome to the NSCHBC Edge Podcast, leading the way in the business of medicine. Now here's your host, Terry Fletcher.
Hello, everyone, and welcome to the NSCHBC Edge Podcast. I'm your host, Terry Fletcher. The Edge Podcast is brought to you today by the National Society of Certified Healthcare Business Consultants. Our goal is to discuss healthy business principles, have conversations on the business side of medicine, so that you and your practice can thrive and be profitable and successful for years to come. The NSCHBC is a proactive organization with over 300 members, including legacy members, that share their wealth of knowledge and expertise with each other in all fields in the business of healthcare. For this episode, I would like to welcome fellow NSCHBC member Rozmin Bapat of CodeRite Healthcare Consulting. She's based in Allen, Texas. They are a billing, consulting, and revenue cycle management company, so they handle all of that for you. Rozmin, welcome to the Edge Podcast, and thank you for joining me today.
Thank you so much, Terry, for having me. I'm happy to be here.
Good. Well, I'm very happy to talk to you, especially about this topic. I know that it comes up every once in a while, and I think our listeners will be really happy to just kind of get some insight on there from somebody who actually has them and from two of us who actually are remote workers. And remote workers, virtual workers, anyone who's working not physically in a brick and mortar office, but working from home. I know we've got hybrid workers. We want to talk about how to manage them, what it means to be a remote worker, the pros and cons, and so on. So I know that's part of what you do in your business, correct?
That is correct. Yes, we did pivot during COVID for sure.
Okay, well, good. And I know that let's start there. One thing that is kind of interesting to me that I noticed during COVID, and this was, I don't know, I think this worried me more than anything. And as I'm going back on site, just doing consults for practices, I've noticed that not everyone did oversight or did HIPAA protections or even looked to see what kind of options their workers had to pivot to stay at home, a private workspace or a place where nobody could hear them talk about patient information or have any kind of desktop computer or even tablets or whatever that wasn't accessible to the family. Did you find that was an issue, or how did you survive that kind of situation?
So we actually, of course, when COVID happened, everything was shut down and we had to make decisions right away. But when I decided that, this was going to be the norm going forward, we actually had to sit down and do a lot of policies and procedures, taking HIPAA into consideration, and also making sure that hiring certain vendors who specialize in things like, data security and how to connect via VPN and all of that. So I did put a lot of stuff in writing, took some time to do that. So I do think that businesses should do that. They should take time to write things down and give it to their employees. And my employees have to send me pictures of their area. I have not gone to their homes and done any kind of inspections, but I do know that they have their dedicated offices. They've shown me pictures. I have it in their files that they have a dedicated space. We have certain rules written down on locking their computers, and just a lot of things that are in writing that they can refer back to.
That's actually a great idea. I never really even, thought about doing it that way. I think that some practices just said, okay, we're going to just have you work at home and not worry about it. And that actually, from what I'm told, was part of the Change Healthcare hack too. Just some of the things that there weren't protections in place in some of practices, which left them vulnerable to, cyber hacks and HIPAA unprotected information. But let me take a step back a minute just to kind of enlighten our listeners a little bit. So remote work is defined as a flexible work arrangement in which an employee under a written remote work agreement, as you have said, is scheduled to perform work at an alternative work site and is not expected to perform work at a brick and mortar or an agency work site and on a regular or reoccurring basis. They actually have that flexibility to work from home. Now, in saying that, the Wall Street Journal published in February says workers who are remote 5 days per week are 35% more likely to possibly be laid off than hybrid or fully in-office employees, because they said that when employees need to cut their workforces, sometimes they bias into the employees that are at home. Now, I don't know, who they polled. I don't know if that's primarily just every workforce in healthcare. I know it gets interesting because you have to have some on site, but us both being in the revenue cycle management sector, have you found that it has been, I don't want to say the word helpful, but do you feel like since you've gone remote, and I don't know if you did before the pandemic, but how is productivity as far as having people work from home and not get distracted with kids and pets? And somebody said they like working from home because they can nap.
Yeah. Oh, wow.
I know it's easier to nap. Well, I'm sure it is.
No, I have seen productivity increase for sure because they don't have to commute. They don't have that added 1 hour that they have to spend on the road.
Right.
There's less wear and tear on themselves and their vehicles and stuff like that. So those things are important. We have benchmarks, of course. We've always had them, even when they were in the office. We've had benchmarks and productivity benchmarks that they have to meet on a weekly basis, which I get reports from them every week. And then, of course, being in revenue cycle, a lot of that has to do with submitting a number of claims, working the number of denials, what kind of money we're bringing in. So those are all measures that are looked at, and I get the productivity reports every week. But then we also have a monthly meeting where we go over all of that with everybody. And then there's incentives. There's like employee of the month, and then bonuses and things like that. So that all motivates these employees, I feel. So there are a number of ways you can actually keep your workforce engaged, and provide them incentives to work at their full capacity. And having said that, I know that being in the office, a lot of employees will kind of look busy, but they're not.
Yeah. Yeah,
We've
you're right
seen
about
those, right?
that.
Yeah. So they will, because it's a warm body there, so they'll look busy, but at the end of the week you see that they've barely like done anything. But this, and it's not to say that every person that I have or had has done a fabulous job working remote. We have had to let some people go because of the fact that they were more interested in maybe taking a nap during the day. I don't know, because their productivity was showing that they weren't really doing what
Yeah,
they were
or being on
supposed
their
to.
phones or social media, right?
Exactly, absolutely. So yes, we've had let people go, but I do feel that people who feel that they're being appreciated, they're being recognized, they will put in the work. So it doesn't matter if they're in the office or remote.
I do like that. And, I was looking at the labor and statistics information that just again came out in February. It seems like February is the stats month. And just like you said, you're very close to what they were saying. They say remote workers save an average of 55 minutes every day by not having to commute to and from work, which is great. One thing that I guess it didn't even occur to me, there's some environmental savings too. They said that, it cuts greenhouse emissions up to 54%, because of, getting people out of their cars and, not putting that in. But what I have found that was very interesting as far as the benefits from working from home and what people actually want now when they're even looking for a job is the option to be remote, the option to have virtual and no commute. They say it saves on gas and lunch costs. They don't have to it's less time getting ready for work. And apparently a lot of people say it's better for quiet time, and they said fewer meetings, which I found funny. So
I don't know about fewer meetings. I think we're more connected when
I
we're
know.
remote
I
than
was like,
anything
I don't know
else.
about
Yeah.
that.
Yeah. So, one thing that I know, Terry, is that a lot of new coders and people who are trying to enter our field, they're being fed this information that, oh, you can work remote, day one and things like
Right.
that. And then they kind of come in expecting that. So that's one thing that's kind of off-putting for me,
Me too.
because even
Me
when I
too.
do hire so we do have a brick and mortar office. It's more like a storage, or so since I told you in the beginning that we have certain policies and things like that, like none of my employees are allowed to print any kind of PHI in their home. So everything that gets printed, like if they have to send out HICFAs or any of that, they have to go to the office. And that's why people that I have, even though they're remote, they're actually in the Dallas-Fort Worth area. So they're in the Metroplex. That's one of the requirements I have. We're not hiring nationwide or anything like that.
Oh,
So
okay.
that's probably different from some other bigger companies. This gives me a little bit more control, I feel.
Because if you need them to come in,
Mhm.
that's an option. That's an option for you.
Exactly. So that's one of the things. And then our monthly meetings are also mandatory and they're on site. So we have a
Nice.
conference room at that building where they come in and all of that. So it's a hybrid in a way, but then when we hire a new person and onboarding and all of that, I do ask them to come to the office for at least the first week or two so they can get trained hands-on because when I'm in the office and if I'm training them and I have something else going on, I'm sitting next to them, I can still get some other things done, right, while I'm
Right.
training them. But if I'm on Zoom, I have to give that one-on-one dedicated time, and then I can't get anything else done, right? So those are some of the things that I've established, knowing what kind of return it will give me for my business. I know it may not be traditional for other billing companies because I know other billing companies or RCM companies do have people nationwide and they even have like, staff offshore.
Right.
And if that works for them, that's perfectly fine. We're still a very small company, so we have to do what we need to do to be able to function in the little capacity that we're in.
Well, and it sounds like it gives you more managerial control too, to really have more of a hands-on type workforce, and I appreciate that. One
Yes.
of the things I remember prior to the pandemic, and it's interesting because I say that every once in a while, and I always have people say, well, I didn't start working until 2020. And so sometimes I'm like, oh, I forget some of the age group that, that's out there.
Mhm.
Especially when I talk about telehealth, they're like, well, I don't remember it prior to the pandemic. I'm like, oh, yeah, that was 4 years ago. But I noticed that if there was even an option of remote work prior to the pandemic, I'll just say it prior to 2020, it seemed like it was employers, and it kind of seems like it goes along with your mindset, very similar anyway, that first you had to prove yourself in person. And then
Mhm.
once they found that you're reliable, you had, good productivity in person, then you were trusted enough to go remote. And I'm not saying, people out there can't be trusted day one, especially if they have a track record. But it just reminds me, especially since you and I are in healthcare, it reminds me of the same thing as seeing a new patient, in
Mhm.
a practice. I don't like telehealth for new patients. I don't think you build that relationship. That's just a personal opinion. I'm not saying it shouldn't happen. I'm just saying I don't like it.
Mhm.
But it is available more widespread to established patients because now you have that relationship, and that just kind of laterals to me. It reminds me that I think that a lot of remote workers, if you're going into, and this is for people who are hiring or looking for people, or even out there if you're looking for work and listening to this, I think if you're flexible and not going into it saying, I'm only going to be a work from home person, only going to be a remote worker, I think you limit yourself into
Mhm.
what you can do, especially if you're not willing to at least be flexible to a hybrid situation, or at least come in, like Rozmin was saying, as far as, at least starting in the office and then being able to take a step to the remote part of it.
Yeah, I certainly agree with everything that you said. Face-to-face time is important, and if companies can do that and make that face-to-face time mandatory or something that's expected in the beginning of the employment, then you can loosen the strings a little bit going forward and allow that. And honestly speaking, the reason that we went remote was because of the cost, because it was purely financial, honestly, for
Yeah,
me,
a lot of
because
people. Yeah.
the rent was just going through the roof. And then of course I met with this IT vendor that I have and all of that, and everything's HIPAA compliant, and kind of had to see what it's going to cost me and what are the savings and all of that in order to do this. Because for me, my ultimate dream was to I have the biggest office on, in the highest building in the city. That was
We all
that.
dreamt that one day.
Yeah, like it's like the corner office, I'm the boss. That was
I
the
know.
dream. But
Great view, right?
right, exactly. But of course, COVID changed all that, and I'm pleasantly surprised how well it's working.
Well,
Because I was still skeptical when I did implement this, and I was like, okay, let's try it. But I'm just so happy because it's not just my employees are productive. I feel I'm more productive.
yeah.
I'm like happier also, working from home. Now, if I have to commute to my office, which is like 20 minutes away, I'm like, oh my God, do I have to go? But of
Do I
course,
have to go
I
in
have
today? I
to.
know,
Yeah.
right? Well, and for me, I mean, I'm, educator and auditor, and I'm like 90% remote now, 90%
Mhm.
virtual. And I can't even imagine without the internet and, remote access into systems and being able to do things from home or from my desktop. Because before, when I would audit, I'd have to lug myself and my staff, if I had more than one person with me, to the office. They'd have to find space for us to work, and not a lot of practices have a conference room. They are limited on space as well. So it's definitely, I think, made it easier on both ends. But I wanted to ask you a question. Do you, and this is, you can put it in a generic sense. I don't know if your staff is listening, so I'm just trying to, I want to make it as generic as possible. And this is more just for feedback for people who are listening to the podcast. Do you feel that this remote work or even hybrid, does this seem to lessen salaries because of how much savings they feel that they build into saving the employee?
Lessen salaries, you mean like the overall salaries that I have to pay out?
Yeah. So do you
Um,
offer less because the person isn't going to be spending money on gas and clothes and because I think a lot of salaries are kind of built into a little bit of employee overhead. But when that goes away, does that seem that the remote worker makes a little less?
Actually, no.
Okay.
Things haven't changed in that regard, at least for what I have seen,
You're like, at least for me, it
especially
hasn't.
at least for me, it hasn't. Yeah, I'm thinking about this, and I'm like, no, I don't think so. But it's for new people. Like if I have like a brand new coder who's never had worked in the field, and I have to train them and all of that. Yes, absolutely, their pay scale is a lot lower than somebody who's more experienced. And then I've also, it's when you do go remote and you have to depend on a lot of on your employees to kind of work on their own with minimal supervision, you have to pay them their price.
Yeah.
And because that's important, because otherwise then they will, take shortcuts, take naps, and, all of that. So
Back to the naps thing.
yes, exactly. That's actually
Exactly.
actually very interesting. But yeah, so no, I don't think that's changed. And I don't think it would be fair for me to even say that to an employee that, oh, just because you have gas expense, I can pay you less. I don't think that's right.
Yeah, I noticed that the bigger companies like Amazon and X, formerly Twitter, and I think one of the bigger healthcare systems, comparing that with flexible hours and not having a daily commute, saying, well, now we can get, I don't want to call it cheap labor, but less expensive employees because of that savings. So I was just curious if you felt that it crossed over to healthcare. I'm not seeing it as much in healthcare, maybe slightly, but not as much. So that's what I was noticing because a lot of, especially in revenue cycle management, a lot of healthcare jobs on the administrative side of it are could be done remotely, aren't necessarily something you have to be in the office for.
Correct.
Yeah,
Absolutely.
so that's crazy. So, what do you feel that your most of your challenges are from a managerial perspective? Obviously, you mentioned one as far as you have to make sure that you've hired really good people that can work independently that you trust. But how do you manage a team from a remote perspective? Is Zoom your friend? How do you do that?
So that's a really good question. So we do have a chat app that we use, which is turned on the whole day. They're required to have that on. And we do have a voice over IP phone system where it's like there's green, red, yellow, whatever, so I can get to see what they're doing. I mean, of course, we're not, we're not counting keystrokes and things like that.
You're not
But of
micromanaging,
course,
right? Yeah.
right, exactly. But there is a trust and reliability factor, and I do make that very, very clear to my employees. They know I'm very accommodating, I'm very lenient, like for doctor's appointments or, you know, to pick up the kid from school or whatever. Those are
Right.
all things that I know that are important, and they're kind of built into our daily workday. But the trust and reliability factor plays a big role here. And they know that if I can't trust them, then they're probably not a right fit. And that's, like I said, I've had to let people go who I have felt that, they've taken advantage of my niceness. And I'm like, don't take my niceness for my weakness. That's my thing.
Exactly.
So it's just you have to balance it out. You have to see if people are trustworthy or not, and they'll show you, what they're all about.
Yeah.
And then you have to just kind of see, okay, you want to keep certain people, you want to let certain people go. So we have the chat mechanism, we have the phone system mechanism where I can see if they're online or not. And then also we do weekly Zoom huddles. So
Okay.
every Thursday at 3 o'clock, we actually do a huddle. So it's basically just to kind of see everybody, each other, talk about our day, talk about our week, any kind of challenges. We're not doing any kind of, shop talk like numbers or anything like that. Kids can make an appearance, furry friends can make an appearance, it's just a kind of like end of the week kind of, let your hair down kind of a
Oh,
thing. So,
nice.
like a social hour, happy hour kind of a
Oh,
thing.
that's
Of
cool.
course, they can't have
I
alcoholic
was going to
drinks,
say
but
without the alcohol.
without the
Exactly.
alcohol, right? But
Well,
because they're still on the clock.
and the one thing that's probably because you don't hire from out of state is easy for you is the fact that you don't have time issues as far as time zones. I know that there's a couple of pharmaceutical companies that are saying, yeah, we're going to have people come back in the office, blah, 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 because you've got people in California, people in Boston, some people, like you said, out of country. And it's really hard to have a team meeting when everybody's got, 3-hour time difference and you have one person that has to be on the call at 4 a.m. and other people at 7 a.m., that's not really fair unless they get to
Correct.
also sign off at some point. Or the calls at, 4:30 in the afternoon, West Coast time, but now they're like, wait, that's like 7:30 my time. I'm already down with the kids and dishes cleaned after dinner, so that's one thing I do find with remote workers as far as a complaint is they seem to think that a lot of their employers don't know when the day ends or begins.
Mhm.
And they feel that they're on call 24/7. I said, well, that's where, and you said you have written, policies or written agreements. I think that's where, boundaries have to be put in and expectations on both sides.
Correct. And I don't ever text or call my employees after hours because, after 5 o'clock, we log out at 4:30. Our timings are 8:30 to 4:30 Central Time. And when we are out, that's my time with my family as well, with my husband and my daughter. So if I'm doing that, it's the same thing for my employees. So it's like practice what you preach kind of a thing, right? So that's what I try to do as much as I can. Of course, sometimes I'm just like, okay, I need to get this done, or because I have my email on my phone, so I'm checking it 24/7.
I know,
But
me
that's
too.
that's
I
not,
can't get away
that's
from
not
it.
expected. That's not expected of my employees at all.
Oh, well, that's good. Well, it sounds like so it sounds like you really believe there's a lot more positive pros for remote workers than cons.
Yes, absolutely. But like I said, I do have my rules, right? Like I'm
Yeah.
not hiring anybody that's out of state. Everybody has to be in the same area. There's mandatory on-site meetings. First 2 weeks is onboarding on site. So those are all the rules that I have, and I make that very clear ahead of time. And of course, the whole remote work policy is written and they sign it, upon hire and all of that. So when you have all of your T's crossed and I's dotted, I think there's less ambiguity and less, surprises, I
Yeah,
guess.
and that's a great way to kind of up the discussion. I think for those of you out there that either are considering, allowing your employees to continue in their remote work, or if you're considering allowing them to then pivot to remote work if you've brought everybody back in, if it's possible, obviously front desk staff and back office, certain not administrative, but more clinical staff, that's not an option. But for your administrative staff, for those of you that are out there, make sure you set boundaries, set guidelines, and make sure your employees sign off on it so they know expectations. It's just like you wouldn't expect an employee to start day one and know what their job is unless you train them. Well, I think the same applies here when it comes to expectations for remote work. And Rozmin, I hope you would agree with that.
I agree. Yes.
Yeah. So, okay. Well, I really appreciate you being here today, and thank you for being a guest on our show.
Thank you so much. I loved it. Thank you so much.
To find and contact Rozmin, you can find her on LinkedIn or at NSCHBC website. Go to Find a Consultant and type in ROZMIN into the first name, and she comes right up. Also, as a reminder, the NSCHBC.org website offers monthly free webinars on a variety of topics, as well as a quarterly Medicare regulatory update. Please go to NSCHBC.org and click on the tab Upcoming Education. We have a variety of topics in 2024 that you don't want to miss. Our next Medicare third quarter update is Tuesday, September 21st at 11 a.m. Eastern Time. Actually, I'll be the speaker for that one. And again, go to nschbc.org to register. That's it for us today. Everyone, make it a great day, a great rest of your month. And thank you for listening to the award-winning NSCHBC Edge Podcast. I'm your host, Terry Fletcher.
Thank you for listening to the NSCHBC Edge Podcast. Join us on the second Tuesday of each month as our consultants tackle the complexities of navigating the business of medicine. You can reach us on the web at nschbc.org, the National Society of Certified Healthcare Business Consultants.